Hi, everyone. Cancer, HIV, malaria, diabetes. These are what we usually think of as the world's big global health problems. But people don't often think about hearing loss. Most of us plug in our AirPods or headphones without thought and are even tuning into this Zoom call now without thinking twice about our hearing. But hearing disability is a greatly overlooked disease burden in the world today. 1 in 20 people around the globe have hearing loss, and it's estimated to be 1 in 4 by 2050. And as Dana mentioned earlier in her TED Talk, hearing loss has significant effects on individuals' quality of life. So knowing this, we need to identify efficient and cost-effective strategies to reduce the significant burden of hearing loss that we see today. And to do this, we need to determine the barriers and facilitators to scaling up hearing healthcare for people around the world. So what are the main obstacles that we need to tackle, and what works? What strategies and innovations should we ramp up? And what is the evidence showing us? So this is the type of data that I've been working with this summer. And by figuring out what's impeding and what's helping people get hearing healthcare, we can design targeted evidence-based policy to combat what's hurting people's access to care and bolster what's helping their ability to get care, and in turn, reduce the global burden of hearing loss that we're seeing today. And so evidence-based policy action is what's needed to mitigate this burden of disease. So, for example, what does it look like to apply the data that we might extract on barriers and facilitators of hearing healthcare to the real world? So let's take a newborn child in a rural community in South Africa, for example. Some common barriers our data is showing us that maybe there's only one audiologist per 100,000 people, and maybe that one audiologist is 40 minutes away by car for the family to have to travel. And in that one clinic, 40 minutes away with that one audiologist, there may not be enough staff or equipment to screen that child for hearing loss and provide treatment if needed. So now at the same time, we also see data on new innovations for increasing screening access through community-based hearing healthcare worker training programs, for example. We see that community-based training programs are an effective way to get more children and families access to screening. And so with this data, we can work with health system leaders towards developing policy that maybe implements increased training for community healthcare workers. And now over time, maybe with increased human resources through community-based hearing healthcare training programs, South Africa can work towards a universal newborn hearing screening program to address their previously overlooked child hearing loss, and in turn reduce the number of hearing disability cases seen in the country. So this is the kind of data that we're synthesizing and the resulting policy actions that we hope to be able to influence with our work. And of course, tackling hearing loss is going to take more than research. Policymakers and world leaders must be dedicated and invested in taking action to mitigate this far overlooked disease. And we hope to be able to work with leaders from nations around the world to translate our research into evidence-based policy development in hopes of reducing this large global burden of hearing loss that we see today.